I think as our population ages, we continue to see more and more patients with chronic low back pain, more and more patients with peripheral neuropathy, uh, obviously becoming more and more common in the population. And then on top of that, we're also seeing, the other maybe less common things like occipital neuralgia or trigeminal neuralgia. So I think that chronic pain has become more and more prevalent, over the last bit of time here, especially as we have a more aging population. So I think that what I want people to know is that we have options for treatment for a lot of these things now. And while they may not be perfect, they oftentimes will provide people with some level of benefit with regards to their pain. So, for people outside of neurosurgery and outside of pain management, seeing these patients, I want them to know that we have options to help them, and that there are things we can do to hopefully make that chronic pain better for them and improve their quality of life. There are a lot of different options for a lot of different patients, and I think that one of the things that I try to stress when I talk to other clinicians is if you have somebody who has chronic pain and things are really difficult and they're having a hard time controlling it, send them our way. I think there are some options that we can often discuss, and it's getting less and less common that I have to tell somebody there's not much we can do for this. There are at least some options that we can try to get them some relief. Two of the newer procedures we've started doing are basivertebral nerve ablation, which is an ablation of the nerve in the vertebrae of the low back for low back pain. And we've also started doing peripheral nerve stimulation of the dorsal ramus for low back pain. And that's for patients that have uh, atrophy of the muscles in their lower back with chronic back pain. And I'm really excited about both of those. We've just started doing them over the last year here at Allegheny Health Network, and we've had some really good results so far. Patients have done really well, and they're really excited about the results they've gotten from these procedures. And these are patients that in the past have not had a great option as far as treatment goes. So we're able to provide these new treatment options for these patients that maybe in the past have been told there's nothing we can do for your back pain. So we've had patients that have of these procedures, we proceed to do the procedure and get them some relief. So I'm really excited about that because it provides us another opportunity to, treat someone who maybe doesn't have another avenue to get treatment, or potentially do something that's maybe of a little bit lesser invasive nature, uh, as opposed to a bigger surgery, and get them a similar, if not better, result with regards to their pain. Things that we've tried to do is in our department, we try to have a pretty collaborative relationship amongst our partners, and we try to have a discussion about what we think is best uh, for patients, whether that is the big surgery to maybe do a correction of a deformity in their spine, or is it a smaller surgery first, a smaller procedure first to try to get them some relief and hopefully prevent the big surgery if possible. So we try to have a really collaborative relationship amongst all of our partners here at Allegheny Health Network. And if I see someone that I'm not sure if they would be a candidate or a better option to have the bigger procedure, I'll reach out to one of my partners and have them take a look at things. And they do the same to me. If there's somebody that they really are in a lot of pain, but they're maybe not a great candidate for the bigger surgery, they'll reach out to me and have me take a look at things and see if there's something on the smaller side that we can do, one of these newer procedures that we've been doing. So I think that the thing I would stress is we have a lot of options. We're really collaborative, and we're going to do what we think is best for someone to get them relief. And I think that's obviously the best option for patients